most famous physical therapist on the internet.
Good to be back, Brad. Did you miss me?
Oh, yes, Bob. Bob, it was pure depression for me for a week.
All right.
And
Hi,
now
folks.
I'm feeling good.
All right. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course,
Back
Bob.
on point. 3 simple beliefs that fix pain and 3 that never will.
Oh.
This is based on my experience, Brad.
Okay. Well, this will be good then.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, we got the big one going on this week, Brad.
Oh.
Go to bobandbrad.com, go to the giveaway section because we're giving away a Sleepovation mattress. This is just a sample of one. This is not the full mattress.
They're full size.
Yeah, you can also find the contest pinned at the top of the page.
That's right.
Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. Just real quickly about the mattress, Brad, really good for pain, I think, for pain relief. 700 individual mattresses like this, got air channels. It seems like, I think some people think it's too soft. I mean, by looking at it, but it's actually fairly firm, medium firm, I would say, wouldn't you?
Right. Well, Mike, one of our other people, he just got that one, and he said he could never sleep on his back on his old mattress. Now he can sleep on his back.
Well, you have the same. I thought you had the same.
Well, my experience too, but for different reasons.
Sure.
Yeah.
All right. We'll also throw out a couple pillows. These pillows actually have springs in them. This is a cross section of one, so you can see what it looks like inside. But there's one, and let's go on to the show here.
That's right, Bob.
All right. I've been seeing patients for 36 years, Brad. Does that sound like an old guy?
Oh, you must have got the calendar out.
Yeah, I figured it out. I used my addition. So I'm not judging, but if I could convince a patient of these 3 beliefs, truly convince them, I think they have a better chance of getting better than if they don't follow these 3 things. Wow. And I've just seen over the years that the people that have this natural feeling about getting better, they get better. So we'll go over the 3 points.
Okay, good.
So I may confusing you a bit, but I'm also going to go over the 3 opposite ones that I see in people, and I see those people, and my head drops a little bit because I feel like
you've got a challenge.
Yeah, I got a challenge. I gotta turn them around.
All right.
I gotta turn the ship around. All right. The number 1 belief. So I, the patient, am responsible for getting better. Me. When a patient comes in and they're thinking that, they're not thinking, what are you going to do for me or on me? You know, are you going to...
it's like some possibly lifestyle, maybe that's over-exaggerating, but some little changes that can make big differences if you take care of it yourself.
Well, doing the exercises too.
Right. That's a good point.
Brad, how many times have you seen this? Like you give somebody some exercises. I usually only give them one the first time because I want to test them and I want to make sure they do it. I say, I'm only giving you one exercise so that I make sure that you do it. And they come back in the second time, and what do they say sometimes?
It's no better.
No, sometimes they say, I didn't have time to do it.
Or you know what I do?
What do you do?
I'll give 1 to 3. I like smaller numbers too, but I'll say, can you show me the exercises?
The second time.
Yeah, the second visit. If they can't show me, I know they haven't done them. Or this.
You're sneaky.
Well, yeah. Well, yeah.
But that does work.
Psychology.
Right. You are a master. So I'm going to lay it all out there, Brad. Years ago, I had some hemorrhoids. Ooh. I know it's the older thing, guys, but and they were bad to the point like, I'm going to go in, I'm going to just have this taken care of. I don't know what they do. They must do some procedure.
Right.
Yeah.
So this relates to the point.
It's going to get there.
All right.
I met with the doctor a couple of times, and it finally dawned on me what the doctor was trying to get across to me is I need to make the changes so this gets better. We're not going to do surgery on it.
So what kind of changes were?
Well, I was already eating a lot of fiber and stuff like that, but I don't want to get into this part of it because this is really gets personal. So, but I made the changes, and it got better. And, it went away.
So the doctor told you what you need to do.
Right. And I had to take responsibility.
Sure. Yep.
So look at the sacrifices I make for this channel.
Right. Yeah.
That was a big one.
We went there.
Okay. Number 2, your body, the patient's body, it wants to heal.
Sure.
You got to understand that. There's a book by McKenzie.
Robin McKenzie.
Yeah, Robin McKenzie. And he's was a great physical therapist. Probably the most influential therapist in the world.
I would think so.
He had pictures, and he was trying to make the same point of how the body wants to heal.
Sure.
He showed a picture of a hip that had dislocated, and this was years ago, like before there was doctors and surgeries. Yeah,
they were so common. Yeah.
and on autopsy, they took a look at it. It had dislocated. It formed a new hip,
Yeah.
and the person was able to
I saw
walk.
it. Yep.
That
Yeah.
was just amazing to me. That, I mean, the body had formed a new hip. It
Right.
had created cartilage and a socket and
Sure.
the whole thing.
So right, and I've done that myself as far as with my patients, but even myself when my back was bothering me with spondylolisthesis, and seemed like it was getting worse, and I just thought, maybe I need surgery, and I decided, well, what would happen 50 years ago when surgeries weren't an option,
Right,
or if
right.
it wasn't serious,
Yeah, what would the body do?
right? So I just decided I got to look at this more carefully and start doing the exercises that I knew I should do on a regular basis. So I did that, and over the next year, it turned around, and the symptoms are much better. I'm in control.
It's
of
under
it.
you're managing it.
Right. I'm responsible for that.
Yeah, and that's
my exercise.
It's funny how you came upon that yourself, and even as therapists, we don't always realize it ourselves.
Right. It's different to think of it as a therapist.
Right.
But when it's
yourself,
when it's on you, it's like, oh my gosh, I'm the patient now. I better be a good patient.
Well, when it's on you and you're experiencing the pain every day, and
Right.
it seems bleak, it's very easy
Yeah.
to give up and
Yeah.
say, somebody just do something for me and get
Right.
rid of this.
So basically, a little discipline, a little optimism is really important. Maybe a lot of optimism, a lot of discipline in some cases.
This third one maybe doesn't always fit, but generally, as a rule of thumb, the third thing that people believe, if they can buy into this, is to get it moving.
Sure.
Get generally, if you're having a pain issue, we want to get some type of movement that doesn't make it worse,
right?
But maybe doesn't make it better either, but it just keeps it neutral, at least getting movement.
And that is really the job of us therapists.
Right.
People come
convincing them and showing them.
It hurts no matter what I do. So then we have to dig through it. And that's what our job is, to figure out an exercise protocol that doesn't irritate it, that doesn't hurt, and to show them the path.
Yeah, a good example is back pain, and we always try to get a person walking right away with back pain, because so often people think that it hurts, so I can't move it. And that's going to lead me to these three things that I see in people who generally don't get better.
Sure.
So number one, just the opposite of the ones I just said. Someone needs to fix me. It needs to be a pill, a manipulation, a surgeon. Not myself. And that's where I think people become addicted somewhat to getting their back cracked by someone. And
right.
I don't want to disparage other professions, but you know what I mean.
Yep.
If you keep someone coming for 20 years,
right,
he's doing the same thing.
Yep. Really, it's the old our philosophy is teach someone to take care of themselves. Or they teach someone to fish so they can feed themselves for a lifetime, versus give them a piece of food, and they have to keep coming back.
Right.
And there are situations where you need surgery. That
it is, but absolutely. So I don't disregard that, but I'm saying the first part of your mindset should be, I'm going to try to see if I can make myself better.
Right.
That's the first approach. And then if things get just bad, you can always consider surgery. Number two, my body is broken and that the body can't fix it. A good example is you'll see a diagnosis on an MRI of a bulging disc or a herniated disc.
Yep.
And you think, oh my God, I have a bulging disc or herniated disc. Someone has to fix that. Right. Well, what you don't know is that lots of people have bulging discs and herniated discs, and they don't have any pain.
Right.
I mean, they absolutely don't have any pain. It's part of aging, like wrinkles and gray hair.
Yeah, and that is the thing with scans, is they'll show all these anomalies or problems, and oftentimes the body has already adapted to it. It's not a serious problem, and things are good. And again, there are studies that show that time and time again, where a bulging disc is in a person that's completely asymptomatic, and they continue to live their life. So the body is adapted to that situation.
Exactly. I just got an email from a subscriber who said her husband had surgery for his hip replaced. but it's severe. He had severe pain down the groin and down the front of the thigh.
Sure.
He had the surgery, and now it's still there. The pain
Mhm.
is right there, but he's having pain in his back too.
Sure.
So I'm going, it was probably back pain all along, and not
Yeah.
even they probably saw stuff on this, the
yeah,
hip. It probably
yeah,
needed,
yeah.
or could have used some surgery, but
And it can be difficult.
yes,
A
it
lot,
can.
a number of times to figure out what is the right diagnosis. The symptoms overlap, and that's a challenge. That's why it's a practice.
Well, that's why often Brad and I say when there's back pain and hip pain, I'm leaning towards the back is probably the more the
Yeah,
issue.
got to
So
clear that.
get it
first.
clear of that first, yeah.
Mhm.
And number three, a lot of people when they're having pain, they think, I'm just not going to move this joint. I'm going to let rest it.
Yep.
Rest is best. Movement's going to make
Mhm.
it worse.
Yep.
And after a fracture or something like that, or after surgery, yes.
Right.
But
right.
at some point, we want to get it moving. It gets more blood flow to the area. The body starts
Right.
adapting, and you'll get better that way.
Which is
So.
an understandable
Tough.
thought.
Yeah,
you know,
exactly.
You want to protect it,
Yes.
but there's a time to get things moving. And again, that's the therapist can really assist someone with that.
And that's why, I've got to be able to talk them into this,
Right.
over a series of treatments.
And a lot of times that's why a doctor will send someone to therapy. It's like the doctor knows they got to get it moving, but they know
Right.
that if they just say, well, just go out and start exercising, that's a little irresponsible because there's certain movements that are going to irritate it, and other ones that are going to promote healing.
Exactly. I was so mad at this orthopedic surgeon who he wasn't sending patients to after knee replacements.
Oh,
He was. I got one like 3 months later.
yeah.
He came in because he wasn't, he had gotten.
And it's stiffened up.
Yeah, it's stiffened up, of
contracted,
course, in
and-
3 months.
Yeah.
So I'm like, seriously? I mean, he thinks that these people can.
Yeah, that doesn't happen too often.
No, it doesn't. You don't hardly see that anymore. So, all right. Thanks everybody for watching.